Hello. This video is going to be talking about trigger points in myofascial pain syndrome. I've personally had back pain since 2002 and have done every treatment you can imagine, from chiropractor, physiotherapy, intramuscular stimulation, which is the dry needling. I've had prolotherapy, where they inject dextrose water solution into your muscles to strengthen the ligaments and the muscles. I've had all sorts of nerve root injections, sacroiliac joint injections, and an MRI showed I had a couple of bulging discs, but nothing major. So, and the incredible thing is that the pain has been at times incredibly bad, where I'm having trouble walking, severe butt spasms in the glutes, in my left glute muscle. Very depressing. So it's been a very frustrating period of time where I'm trying to figure out what's wrong and trying to solve this issue. I came across this tutorial on trigger points, and I did some investigation and realized that I actually do have some really sore spots in some of my muscles in my back and in my glutes, in my hip even. You can see here that these red spots are potential trigger points. A trigger point is basically a muscle knot, and it causes all sorts of different problems for people. I've even had numbness in my left leg as well. So these things can cause symptoms that people seem to think that, the sciatica and piriformis syndrome was one of the diagnoses I got. And I had active release therapy, which actually caused me to get a lot of spasms in my glutes, which was really incredibly painful. The interesting thing about the trigger points is that they can be away from the actual pain point. So there's what they call referred pain. So I actually noticed that the trigger point in this area, upper glute area, hip area, when I sat on a tennis ball, it would actually refer the pain down, where it's similar to what I've been experiencing. So this tutorial, I just wanted to show you this amazing tutorial. There's a famous book, the Trigger Point Therapy Workbook, but this is a more recent tutorial that has a lot of reference material and more recent studies, and such as botox injections and analysis of all these different therapies. So if we go down, we can look at this table of contents here. Muscle knots, and even discusses fibromyalgia, looking at therapists and whether, how to find a good therapist. Some checklists when you do have trigger points, if you don't. Some case studies. Some of the science explains the sarcomeres and how part of your muscle is actually really tight and the other part's actually stretched and loose, so stretching may not be the best thing to be doing. Referred pain gets into self-treatment. There's a quick reference guide, and there's different methods and some mistakes that you can make. And then if you have some real stubborn trigger points, persistent ones, some extra things that you can do to treat some of this stuff. Some of the tricks with the bathtub, and the goes into stretching, how it might not be that great in this case. How do you find good therapy? Actually looking at asking some questions of your therapists and doctors to see if they know what they're talking about when it comes to trigger point therapy. And there's some interesting commentary on what about ultrasound, what about botox, nerve blocks, dry needling, acupuncture, active release. There's even stuff on prolotherapy. So this article is utterly massive. This tutorial goes down and down and down. And Paul, who wrote this article, I'm just going to scroll down here. Oh yeah, it goes into the different types of treatments with the balls and the different He describes the various products that you can look at. But a huge article, but he's always updating this. If we scroll down to the bottom here, we've got August 15th, 2009. As he gets questions, he'll continually add new content, which is great. Okay, so I highly suggest you check out this tutorial, and I've provided a link to the articles next to this video. So give that a try. See if you've got some sore spots, depending on if your lower back issue or if you have what I have, which is more in the butt area. You'll see some really sore spots here when you use a tennis ball to find them, or self-massage. And I think it's really exciting to basically find these and realize that you might be able to treat yourself and get rid of this chronic pain that you have and that I've had for a long time. All right, give that a try.